Representative Bear,
Here.
Representative Byron,
Here.
Representative Locke, Representative Northrup,
He was excused.
Representative Oakley,
Here.
Representative Storer,
Here.
Representative Strock,
Here.
Representative Zwanitzer,
Here.
and Chairman Harshman.
Here, thank you very much.
Thank you.
Well, I'd welcome everyone here today. We have two bills before us. We're gonna take House Bill 65 first. And so is anybody here for 64? Is anybody here for that bill specifically? That deal is gonna be last. And if we run out of time, we're gonna carry it over. So it's a little bill and it won't take long, but so are you here kind of for the whole session? I just want to make sure you didn't make a trip down there from Cody just for that bill. Okay, so it's not a hardship for you. Okay, very good. Thank you. Anybody else here for 64 that I have every intention of getting to it, but I don't know. 65 is a really important bill, and I think we have a lot of folks here who want to visit about that. Basically, the rules and procedures of this committee is like every committee. We will, you address the chair. We don't want to have conversations between members or between members and members of the public, and civil and treat each other very well and ask for clarifications. We'll introduce the bill and talk about it briefly, and then we'll open it to public comment. And then once public comment, we're going to do everybody in the room here first. And then we'll go to folks online, and we have 3 folks online, all from Wyoming. We'd prioritize Wyoming citizens first online. And then when we close public comment, we'll take a motion on the bill and work the bill. And again, really appreciate you all being here. And you'll see members taking notes when you're up here at the witness stand, when you're giving public comment, and you'll tell us your name, who you represent, and where you're from. We like to hear your hometown here in Wyoming. And we'll be taking notes. There's some members who have their computers here. They're going to be typing your notes. So they're not on the Facebook, or the YouTube. They are actually typing what you're saying. So please excuse that comment. If you're here and have like a phone and you're gonna record us or take pictures, I'd ask you to please not do that to disrupt anybody else. It's all recorded forever, right? And so I think we don't want to stand up and do those things and disrupt other people's view and participation. Okay, so with that, House Bill 65 is now on the table. I think I'm the only returning member of this committee. Okay. Thank you, Speaker Summers. Okay, and we're really fortunate we get to do this work. It's important work. It's committee number 3, but I want to talk about this committee bill, members. I guess I will talk about it. Nobody here from LSO staff, and so it's kind of odd that I'm talking about it, but here we go. So the 988 system, and this is a study topic by Management Council. How do we fund this permanently? And so we had this as a topic for our interim committee. And as you know, the 988 system is now up and running, and the governor funded it with COVID dollars. Okay, and the key on this, and there's experts in the room can tell us more about it, but 988 is a Wyoming person on the other end of the line. And you're going to get your call answered. It's not going to keep ringing and maybe go to an answering deal in California or Colorado or back east. And so you're going to have a person in Grable or somewhere answer the phone and talk to you. Okay, so if you go through as you flip over to page 2 and 3 are definitions, okay? And you see administrator is defined, the contact is defined, crisis center or crisis hotline center, and then crisis facility, and those are through other definitions, refers to that. The department is the Department of Health. The mobile crisis teams is defined as well. Okay, so the rest of the bill really lays out this, really the 988 and the crisis center designation. I'm going to flip through 3 and 4 and 5 and really get to really the funding of it. And so payment, it's not going to be billed. We've talked about that. Back to page 10 really is where we've tried to create now a trust fund. And we've done this in other parts of our state government. The Wildlife Natural Resources Trust Fund is one that comes to mind. It's not a inviolate, constitutionally protected trust fund, but it's a fund that will generate revenue to fund this system in perpetuity and other suicide prevention services. And so as times change, maybe 50 years from now, there is no 988 system. Then the legislature 50 years from now, I don't know what that'd be, it'd be about the 92nd or something. They can change it. And so it's not in perpetuity like the Permanent Mill Trust Fund or the Common School Account. It's a statutory design trust fund. Okay, and then there is a fiscal note. You can see the, on page 15, actually section 3 of the bill, page 15, section 3 on line 11 is $40 million from the LSRA to the trust account, and then $6 million would set up the reserve account. And how this works, that $6 million is this 5X number you talk about as a reserve account. And if you think about 40 million, you take 40 million times 3 times 5. So 40 million times 3% times 5 years. Because we figure we're always going to get 2% with dividends and interest, right? And so we're trying to, if we have a bad investment year, do we just not have 988 funding? No, that's why we have a reserve account to backfill in the event of a couple bad years of investment returns. So that's really the numbers behind that, the 46 million. So members, are there any questions? And then I'll open up public comment. Representative Baird, go ahead.
Thank you, Mr. Chairman. Welcome back, first of all, to Revenue, since you're the only returning member. When was this set up under the COVID dollars, the program, initially?
You know, I'm hesitant to, because there's people out here who know this, absolutely. And I think those would be good questions for folks. Let me just ask, is there anyone here, or any other questions by the committee, but can I pause that question until? Okay. Is there anybody here opposed to this bill? Are all of you here in support of this bill? Okay, so a lot of times, you know, I don't think this is controversial, but a lot of times you'll have for and against in a controversial bill. Many bills, so anybody wants to comment. So we're just going to open this up to public comment, and let's just look at our time. It is 9:19. So, you know, we've got a solid half hour of public comment time, and we could probably miss the gaveling in and the pledge if we had to, if we're a few minutes late. But figure we got a half hour of public comment time, and I'd like you to use it as best you can. One of you can take 30 minutes if you'd like, or 30 of you can take 1 minute. So I think the most efficient way is to have 3 folks just line up and you just keep filling chairs. So the first 3, please come forward, and we'd love to hear from you. And I guess, let me back up. Representative Zwanitzer just reminded me, is there anybody from state government here or any elected officials, anybody from I see the treasurer's office is here, any elected official, or please come forward. Department of Health, please come forward. We'd like to hear from state agencies. That's my mistake. Thank you, Representative Zwanitzer. We go in this order of elected officials, state agencies, and then we'll get to public comment. So thank you. Good morning.
Good morning, Mr. Chairman. Good morning, members of House Revenue. My name is Franz Fuchs. I'm a policy analyst with the Department of Health. As Department of Health, we obviously take no position on this bill, but we're here to answer any questions you might have. So I have here, we have Senior Administrator for Behavioral Health, Matt Petrie. Of course, you can introduce yourself as well.
Good morning, Chairman. Matt Petrie, as Franz indicated, I'm the Senior Administrator of the Behavioral Health Division for the Department of Health.
Okay, members, any questions? These, Representative Zwanitzer.
Thanks, and thank you, Mr. Chairman. I'm not sure this is right for the department, but for someone, page 9 of the bill, and we're talking about these crisis service teams, mobile crisis teams. You'll apparently select one or multiple, however it worked through the process. But I guess my concern is someone calls the hotline, we figure out where they are, we send a mobile crisis team, and then somehow we have a provision in the bill that the department is somehow set up to figure out if they have an insurance or not. So, I mean, in my mind, we're just gonna go say, hey, it's gonna be okay. We'll connect you to services, and oh, by the way, do you have insurance and what's your number? And I just can't figure out how, in reality, this is going to work. If they get set up with a provider, then we'll find if they're on Medicaid or they have private insurance in the back end. And it just seems like not the, and I understand that there's payment for these services, but I guess I want to know it's going to be at the appropriate time after the crisis event is over that we start asking them how they're going to pay. If the department has any comment on that.
Go ahead, Mr. Fuchs.
Mr. Chairman, members of the committee, so there's a couple ways this could be done. The main way that comes to mind is implementing, basically billing a centralized system so that the provider would bill basically Medicaid, and then the Medicaid system could figure out on the back end if that person had insurance. We have links with, for example, Blue Cross Blue Shield, and we have third-party liability contractors that can look for other insurance. It could be that basically if they don't have other insurance, we just cover that with general fund. But if we do find they're on Medicaid or Medicare or have Blue Cross Blue Shield, then we could basically bill that pay source and try to maximize those third parties. So the state can figure it out on the back end. There's some infrastructure work that's required with that, but it's not too onerous.
Mr. Petrie, anything to add to that?
No, Mr. Chairman.
We had this conversation in our interim topics. I'm glad that Chairman Zwanitzer brought it up, because we used to have this issue, remember, with the 3-day holds. And we had a real terrible thing happen in Casper. I think Representative Barlow was on Health Committee and fixed that. We amended the law and have fixed that, the way we talk about billing and bill people who are in crisis. So great question. Appreciate that. Okay, any other questions for this gentleman from the Department of Health? Okay, appreciate you. And you'll be available for us as questions arise. And Mr. Locke has a question.
Thank you, Mr. Chairman. Question for you. So I'm just learning, so please bear with me. So what is the difference? What's the Wyoming component of this? My understanding is this is a national program, and it is a funded national program. So if somebody from Wyoming calls in, theoretically, there would be an answer from a national number from the national. What is the Wyoming component of this?
Go ahead. Which one of you gentlemen? Go ahead.
Mr. Chairman, Representative Locke, prior to mid-July of this year, there was a system that you're probably familiar with. It was called the National Suicide Prevention Lifeline. It did not have the abbreviated 3-digit call number of 988. It had an 800 number. Wyoming has staffed 2 call centers we're in our 3rd year now, with a relatively small appropriation from the legislature, $400,000 per biennium. Those 2 call centers were covering what amounted to 20 hours a day of coverage. And then we had backup through the National Suicide Prevention Lifeline. Calls that come in to 988 are routed to Wyoming, to Colorado, every other state. What had happened in the past were those calls were routed to those 2 call centers. Any overflow, any calls that weren't answered during that 4-hour period, or even during times that the call centers were staffed, would then roll to this National Suicide Prevention Lifeline. Those could end up in some other state. They didn't, and in doing so, they didn't really have the people answering those calls weren't as familiar with Wyoming. Its resources, its capacity to handle treatment providers, those kinds of things. What happened with the implementation of 988 in mid-July was that, for the most part, we eliminated that, not completely eliminated that need for that rollover and for that backup on a national perspective, but we minimized it. We also began providing 24/7 coverage for the 2 call centers in Wyoming. So they took those 4 hours of the day that were not being covered, which were midnight to 4 a.m. We split those between the 2 call centers. And so then beginning in July, we had 24/7 coverage for people in Wyoming answering those telephone calls.
Mr. Chairman, thank you. Can I follow-up question? So another question, maybe not so much a follow-up as just, so how does this organization work with other, let's say, nonprofits or other suicide prevention functions across the state that are out there?
Go ahead.
Mr. Chairman, Representative Locke, they work with them, and this is an evolving aspect of the program itself. And when, I think prior to July 16th, the emphasis was truly answering those telephone calls. With this bill, it folds in more than just that because of the reference to the crisis services that are provided to those individuals that call. So when I say that it's an evolving process, some of those relationships will still have to be built. Both of the call centers that currently operate in Wyoming have relationships with the community mental health centers. They have relationships that they have basically built on their own to, make those transfers, hand off those individuals who have called the lifeline, get them to that next step in the process where they may be able to be treated, be counseled. But in all honesty, I think that there are certainly more of those relationships and more of that collaboration that needs to be achieved. And that's part of what this bill addresses, I think, and what those call centers will continue to work on.
Thank you.
Okay, thank you. Any other questions? Go ahead, Representative Storr.
Thank you, Mr. Chairman. I'm just curious about thinking about the big geography of Wyoming. And what has been the practice in our more far-flung communities for getting a mobile crisis team to support an individual who's called?
Mr. Petrie.
Mr. Chairman, Representative Storr, again, an evolving process. We do provide crisis funding to the community mental health centers that the state of Wyoming contracts with currently. There is a large national push. It's called the CCBHC. It's through the federal government. Basically, it stands for Certified Community Behavioral Health Centers. That requires that contracted facilities in the state of Wyoming, those that we contract with now, that they provide mobile crisis services. So the provision of those services is coming, the emphasis on the provision of those services is growing, and it will expand. But part of what this bill does provide is that those relationships be established. In rural areas, towns with lower populations, certainly it is a bigger challenge, I think. But it is part of what this bill requires. And as I indicated, it's part of something that we are currently doing with the mental health and substance abuse section of the Behavioral Health Division. And there will be more emphasis as time goes on, simply because federal funding will be tied to it.
Sure, you might.
Is the intention to pay for those services with the funding that's provided through this bill?
Mr. Chairman, Representative Storr, to some degree, yes. We certainly do have concerns about that. I think that the bill itself, we very much appreciate having a recurring long-term funding source for this program. Currently, it is primarily one-time federal dollars. And so we certainly appreciate that. The way that the trust fund is set up and the way that it would function would provide roughly $2 million per year in funding. That is certainly more than what is necessary for us to contract with the 2 call centers and operate them. In the fiscal note, you'll see that we estimate that to be just roughly over $700,000 a year currently. We do have 1 position associated with this to coordinate functions. So there's a small portion of the appropriation that would go toward personnel. The bulk of it then, roughly $1.2 million per year, would be available for crisis services. And I think that $1.2 million a year obviously is a healthy amount of money, but when you look at it in the grand scheme of things, is it enough? Again, there will be other funding sources, as Mr. Fuchs mentioned. Medicaid is available. The emphasis from the federal government for the community or certified community behavioral health centers, there will be money that comes through that as well. But the short answer to your question is yes. The part that we're just not sure about is whether it will be sufficient. You're welcome.
Representative Bear.
Thank you, Mr. Chairman. Thank you for that information and answering my question earlier, Mr. Perry. So 3 years is basically how long we've been operating. Do we have any statistics from before comparison to after the success of the program thus far?
Mr. Chairman, Representative Bear, yes, we do. As part of the National Suicide Prevention Lifeline, they work with national contractors. So they have essentially IT firms that run the back end, the hardware, the software. They maintain those statistics for us. And so what you'll see with the addition of those 4 hours that we were not covering previously, what you'll see are higher call rates. We have seen the time to answer drop significantly. We certainly do have those statistics and pages of those statistics that we could provide to the committee. But we have definitely seen an improvement in those statistics, not only in time to answer calls, but also a reduction in number of calls not answered, as well as a reduction in the number of calls that go to, say, an out-of-state center because they were not answered in Wyoming.
Okay, follow-up.
Thank you for the follow-up, Mr. Chairman. Any statistics available as far as suicide rates now, as far as those completed suicides dropping since we've started the program?
Mr. Petrie.
Mr. Chairman, Representative Bear, I'm afraid I don't have a great answer for that. We do not track those suicide statistics through the National Call Center, through those vendors that support the National Call Center. We certainly do that in the Department of Health. And we could attempt to look at that correlation, whether there has been a drop percentage-wise from the inception of the 988 system in Wyoming, or the suicide prevention system in Wyoming, which, as I indicated, has been in place now for about 30 months.
Who will be here if we have further questions. Appreciate you being here today. Thank you.
Thank you.
Any other agencies, state agencies, those kind of things, elected officials? Okay, now we are going to open this up to general public comment. We'd like you to fill the chairs and then just keep refilling the chairs. Thank you all. Okay, so we'll start on your left, my right. Please introduce yourself. Thank you for being here today.
Thank you, Mr. Chairman. Andy Somerville. I'm the Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. We are those community mental health centers that were referenced by the Department of Health. We work very closely with both of the Lifeline operations, so thank you for having us today. I want to be brief to allow some other people to comment, but I want to touch on some high points. The history of 988 is really important. We've had that 800 number for quite some time. And then in October of 2020, President Trump signed the 988 Designation Act that actually is moving that over, that act to the 988 three-digit line. That act also recognizes and calls for mobile crisis services and crisis stabilization services. And so we've been working since October 2020, knowing this was coming in as a nationwide piece. In Wyoming, you know, I just have to say for the committee, I don't think this is new news. We are number one in our suicide rate per capita. That is a spot we've held for the last 3 years. We're always in the top three. And it's something that it is a crisis for the state. It impacts families, communities. Our most vulnerable populations are our veterans. I believe the committee has been provided some handouts demonstrating those numbers. In the most recent suicide data that we have, our veterans rate is substantially higher than the national veterans rate. Our first responders are disproportionately affected. The business community is affected. It's devastating when it happens. It also has an economic impact on the state of Wyoming. For every person lost to suicide, we lose about $1.3 million in unrealized revenue. Most of that is working. There's a small portion of it that is medical costs, but most of it is economic productivity from the workforce. There is not one solution for dealing with suicide in Wyoming. We have many levers that we need to pull on, and this is certainly one. The committee has received a handout from WAMSAC giving you a brief history of the funding. I think the Department of Health covered that pretty well. I just want to add that, you know, when this, in August of 2020, when we had the first in-state call center in Wyoming open, we were the last state to come online. Every other state had a local call center. That initial $400,000 appropriation was helpful, but we've been doing significant philanthropy work and grants and trying to cobble that together to get to those initial 20 hours in the first 18 months that are described by the Department of Health. That is part of the funding issue, is that grant landscape and philanthropy landscape is not sustainable long-term to be able to keep the service online. So we are funded with ARPA, and we are thankful to the legislature for providing that funding. As part of the conversation in the last session that allocated that money, the question was brought to me, okay, we can do 2 years, now what do we do? And so that's why we're here. We came to the interim committee last year. We presented that committee with an option as described in the 988 Designation Act that was signed by President Trump. The only revenue source in there is to assess a telephone fee. The state can assess a telephone fee, like a 911 fee for 988 on a phone bill. That's the only option that's in that bill. We brought that bill to the Revenue Committee. We had a great, robust discussion. And the other option that was discussed is the trust fund. And obviously the committee decided to go with the trust fund, and that's where we sit here today. It is incredibly important for Wyoming to have local call centers. While getting an out-of-state call center is better than nothing, the concern is, again, they don't know our geography, they don't know our resources, and you end up with something akin to a Google search, and not their fault. But if you're sitting in Louisiana, you have no idea that to get from Cody to Sheridan might be a really big deal in January, and how to get that done. Our best chance at helping people and helping them recover and interceding in a crisis is to get to them early and to get them into resources when they need to do that. With 988 being a national number, the education campaign has already started. This number is being posted in schools, it's in social services agencies, we are seeing it everywhere. So that it will become the number. It is not just a suicide lifeline anymore, it is a mental health crisis lifeline. It will be the front door for mental health access, whether Wyoming wants to or not. We don't have that choice anymore. We feel it's important to have that service online in Wyoming and robust, so that we can continue to work with the continuum of care, the hospitals, the community mental health centers, to get people to the services that they need. Mr. Chairman, I'm going to stop there. We've got clinicians and a lot of other people in the room. Actually, I apologize, I want to add one more thing. In terms of the funding, one of the most important things, the conversation that we need to have is about sustainability. Unfortunately, mental health has a history in the Wyoming state budget of receiving budget cuts when the state loses revenue. Most recently in 2021, the community mental health system was cut $15.1 million. I believe that happened in 2015. I believe it happened around 2010. The last major investment was made in 2005, 2006. This is this, we need this system to be online and functioning, and taking a 20 or 30% budget cut is going to be very problematic. So again, we're trying to work with the legislature to develop revenue that will be sustainable, that will keep this piece of the system online and going. Mr. Chairman, I would stand for questions.
Questions? Okay, thank you very much for being here, and you're available if we have questions further. Go ahead, Ms. Delancey.
Good morning, Mr. Chairman, members of the committee. My name is Cindy Delancey. I am the president of the Wyoming Business Alliance. I have had the pleasure of meeting a few of the new members of the committee and look forward to the opportunity to meet and discuss these as well as any other issue with you for those that I haven't. Just a few moments of just introduction on the Wyoming Business Alliance. We are the state's premier private sector business trade association. And this is a very, very high priority for the business community and my membership. Our membership represents over 500 different members from all different industries, big companies, small companies, all four corners of the state and beyond. So I speak to you, I come before you today speaking on behalf, a very wide breadth of business leaders and really tell you that this is a priority for them. In addition to some of the comments that you already heard, I don't want to be duplicative, but suicide and being number one in the country of suicide is not only a public health crisis, it's a business crisis. We cannot turn our back on our most important asset, which is our people, our workforce. And to have employees come at a time when there could be distraction going on in the home setting, with other family members, it becomes a productivity and ultimately becomes a safety issue. Everyone in business in Wyoming wants their employees to go home in the same way that they came to work as far as being safe. And so by creating this stable and predictable essential governmental service that isn't just subject to, the whims of the legislature as well as the volatility of markets, we really feel is, essential for us to take action on this now and provide a resource besides one-time federal dollars to be able to meet the needs of our citizens. You heard that, number one, unfortunately, in the country is Wyoming. And I know my friend, Mr. Moline over here is going to speak a little bit more, so I certainly don't mean to steal his thunder, but particularly those constituents in the ag community are suffering suicide at the exponential rates on par with our veterans. We have to do better in Wyoming. We must do better. And by having, a locally staffed call center is just, again, another tool in our toolbox to be able to discuss moments of crisis with our friends and neighbors and people like us who understand our custom, who understand our culture, who understand that it's very difficult for those of us that are cowboys to talk about maybe some of our most vulnerable moments in time, as opposed to maybe someone in Delaware or even maybe somebody in the international community understanding the needs of our state and our community. So stable long-term funding is really the goal. The goal also is to find a mechanism where the funding is sustainable, as opposed to asking, putting the cost of an essential governmental services on the backs of our industries that are really driving our economy. To Representative Locke's comment earlier, this would not be a duplication of existing resources. This is an augmentation, again, another part of the solution here, trying to get Wyoming to not have the number one that none of us want. So with that, I know that, there's others that want to speak on this, but, just a basic business principle, prevention is always a lot more cost saving than replacement. And not that a life is ever replaceable, but by having, a tool in the toolbox to be able to help somebody before they're suicidal and then requiring an emergency detention, internal, hospital stay, to maybe have that person when they're feeling a little anxious or needing a little help, be able to get them to a professional to avoid that. Kind of the analogy of changing the oil is a lot more cost effective than replacing the engine. So if we can get ahead of some of these moments where people need a little extra help and be able to provide a mechanism where it's okay and accessible to provide a hand up, this is really, where the business community would like to see the legislature go with this. So thank you, Mr. Chairman. I appreciate the opportunity to speak to you today. Thank you.
Okay, thank you for your comments. Questions, members? And you'll be available for questions later.
Yes, sir. Thank you very much.
Thank you so much. Mr. Moline, welcome.
Thank you, Mr. Chairman. Brett Moline, Wyoming Farm Bureau Federation, sitting in support of this bill. As Ms. Delancey noted the members that I represent, the industry that I represent, have some of the highest rates of all the groups. A little bit out of my wheelhouse here, so this is an important issue. It's nationwide, it's in Wyoming. We're finally realizing it. We've realized it, now we want to do something about it. We sit in support of this bill, and I would sit for any questions you or the committee may have for me.
Okay,
Thank you.
Thank you. Any questions for Mr. Moline? And again, you're available. Do you have a question? Yeah, Representative Straw.
Thank you. I guess my main question is, it's fine, in a lot of the reason they're feeling suicidal is just finances and and our economy, the lockdowns. But my thing is, will this money go to also help them to get this help? You know, if we're spending money this way, but would it be more beneficial to spend this money to be able to help them get out of this situation they're in financially? Because that's most of the agricultural aspect is the loans that they've incurred and just the prices of the livestock, you know, what we're trying to sell. And that's what's caused the hopelessness. So do we have things set up once we get them out of that? Because it's not, you know, we've got to have some things set up after. And I'm just curious what we have for that situation is.
You want to comment on that?
Mr. Chairman, Representative, this is one piece of the puzzle. You're exactly right. Losing an operation that's been in your family for 100 years, to be blunt, sucks. It's tough. And it falls on those shoulders that it's happened to. This is one piece of the puzzle. Get them the mental help, the stability. There's other programs out there, how to not get that far down the road where you lose everything. There's programs out there to help with that. There's help with production techniques. There's production with marketing. You know, there's help with marketing. But this piece is kind of the one that's been lacking. Now, the next step is to get them to take advantage of this step too. And that's where my organization comes in through the work that we can do with our members to get this word out. There is help out there. Help your neighbor. Look at them, talk to them.
Okay, thank you.
So in a nutshell, this is a piece. There's other pieces. There's a lot to the pie. This piece is as important as any of the other pieces. Mr. Chairman, thank you.
Okay, thank you. Questions? Go ahead, Representative Locke.
Thank you, Mr. Chairman. Real question for you. You were talking about what sounds to me like a grassroots approach. Does that exist in this state? Do we have groups of people, you know, good, solid grassroots that are reaching out to try to look at this beyond or separate from this function?
Go
Mr.
ahead.
Chairman, Representative, that's what Farm Bureau is. Farm Bureau is a grassroots organization. I don't make my policy, my members do. I work for them. This is part of getting this information to my members at the grassroots, out in the counties, to know that there's resources out there that you can recommend to your neighbor. That's why I say we will get this information out to our members, encourage them to take advantage of this piece of the pie that's out there, much like we do everything else. So yes, we commit to getting this information out there, getting it to the members at the grassroots, out in the counties where it's needed the most. I hope I answered your question, sir.
Okay, thank you.
Quick follow-up. Thank you,
yeah.
Mr. Chairman. Thank you. And real quick, do you have access to other organizations that are also doing this? Have you gotten involved with other organizations that are already on the ground, even before this, for suicide prevention? Do you have, are you aware of them? Are you involved with them as well?
Go ahead.
Mr. Chairman, Representative, yes.
Okay,
Thank you very much, Thank you, Mr. Chairman.
okay, and you're going to stick around and be available if we have further questions?
If I'm not in this room, sir, I will be available. I am here for the duration for the session, so grab me, use me, just don't
Yeah.
abuse me.
Appreciate you being here this morning.
That was not a good thing to say.
Yeah.
I
I didn't
apologize.
hear, but I don't hear very well. Go ahead, introduce yourself next.
Thank you, Mr. Chairman. Dr. Hollis Hackman is my name. I'm a psychologist from Sheridan. I represent the Wyoming Psychological Association. We have over 300 licensees in the state, but about 150 of us actually have a address in the state. We don't cover all the counties in the state. We do have some gaps, but we are the association that represents the psychologists. And we're simply rising in support of this bill. This is an important thing for us to be doing. And if I can try to respond or answer Representative Strzok's question just briefly.
Sure.
Stressors abound in our state. We have economic stressors. We've had the COVID thing to deal with. And what we know about mental disorders is that they tend to get worse when people are faced with stressors. And we, as therapists, can't really do anything about the stressors in particular, but we can help folks manage those stressors and help them figure out ways to cope with them. And in that, they can find some relief and some improvement. And so the way to do that is to be able to throw people a lifeline. If they're reaching out for help, then you want to have somebody there that's able to get that help going, and then other folks to proceed with that help. And so this is part of that process. This is an important link. So with that, Mr. Chairman, I would stand for any questions.
Hey, Representative Zwanitzer has a question, and then Vice Chair.
Thanks, Mr. Hackman. Thank you, Mr. Chairman, Mr. Hackman. I guess I just want your feedback, because here's my concern. This is being encouraged that this is what connects local people to local resources. So I guess my first question is, in my understanding, we don't have that many local resources, quite honestly, and that's a huge need that's not completely met. In some communities, we certainly do, but I think in my mind, there's maybe one primary local resource counselor center in many of our communities, and the person calling probably likely knows about that, maybe, or knows who works there, and would be somewhat hesitant about having everybody in the community know they have mental health issues. And many other laws we have coming this year, we're exploring ways to make sure, your local county assessor, county clerk doesn't know your financial problems, because that's a barrier to getting help. So I guess your thoughts on, sometimes I would think it's nicer to be connected to people who aren't in the county, who might know who you are, and any feedback on that?
Mr. Chairman, Representative Swanitzer, dare I mention other bills that are pending in the other chamber? We're trying to address that issue, and we're trying to address that in the form of telehealth means, expanding our telehealth reach. That's one of the ways to get around stigma. I get it, driving my pickup truck down in front of the local psychologist's office. Everybody knows everybody in Sheridan. I mean, I'm not going to do that. I'm going to reach out to colleagues actually out of state, because but I'm not here to talk about myself. But the point is, we're working on that issue. We are short of providers in this state across the board, and we have some legislative fixes in the other chamber, and I just need to focus on this bill here, I think. And so that's my best answer, Mr. Chairman.
Thank you. Appreciate you being here and all your work, your life's work. It's really important. There's not folks signing up to take your place either, unfortunately. It's really a tough situation, and we're going to have to deal with that as well. Vice Chair has a question on the doctor.
Thank you, Mr. Chair. Thank you, Doctor. And I don't want to, I know when we're coming in new to a meeting, this has probably been discussed at length, but do you have anything, whether it's statistics or just information, do people who, we talk a lot about, obviously this is about people in crisis, is when somebody's in crisis, do they actually pick up the phone? Like, I mean, is that, you said a question with the premise of, if they are actually reaching out, then we need this. Is it reality that when somebody is in crisis, this is what they're going to do is pick up the phone? And any discussion on that, because this is this the need that we have? Because this is, an expensive system and a significant a significant ask? I mean, and I appreciate talking about a piece. I just am wondering, I mean, is this the need? Is this an effective piece in reality?
Mr. Chairman, Representative Oakley, I'll try my best to answer that question. Part of the answer is the call volumes have been increasing since 988 is rolled out, so people are using the service. If you're out in the middle of our state and you have phone service, but that's it, I mean, what are you gonna do? I mean, at least making a phone call is a possibility if you got a signal. So it is difficult for people to ask for help. I think that's part of what you're talking about. Unfortunately and sadly, there's a lot of stigma around mental health disorders nationally, but also in our state. So it's a difficult hill for us to climb to get people and encourage people to ask for help. But when they are ready to ask for help, we darn sure want to be there answering the phone quickly, and we want to be reacting in an expeditious manner. I hope that answered your question.
Yeah,
Thank you, Mr.
very
Chairman.
much. Appreciate it. Okay, any, Representative Bear?
Thank you, Mr. Chairman. Just to follow up to those other two questions. So you may or may not be familiar with what the process is when someone answers the phone on the other end, but if you are, I'd like to know, is there a difference between getting answered out of state versus in state? I understand there's a difference when you know where you're going to send them to, but the initial process of answering that call and mitigating those first concerns and trying to lower the stress level. And I appreciate what you said about the stigma. Does that also apply to the phone call, or is that just when you're going to the center?
Mr. Chairman, Representative Bear, what we know is that our call centers in the state are, the response time is quicker if the call goes to one of our call states, as opposed to Boys Town in Nebraska. And I'm originally from Nebraska. I got nothing against folks in Omaha. I'm from Lincoln originally, but have been in Wyoming since 1984. But what does anybody in Omaha know about what's going on in Wyoming? So the response time is quicker, and you get folks on the line that are Wyoming people. And Representative, I apologize that I forget the rest of your question.
That's all right. I would just add, I'm sorry, sir. Yeah, go ahead. Mr. Chairman, I was asking about the stigma. Is there a component on the phone, or is it just in the travel to the center?
Mr. Chairman, Representative Bear, I would just have to guess on that. You can make a private phone conversation and nobody's going to know about it. And I think there's going to be less stigma about that because nobody really knows you're making the call. That's my guess.
Thank you for joining us today. Appreciate it. And you'll be here for further questions if they come up.
Yes, Mr.
Appreciate
Chairman.
it. Okay, thank you. Go ahead, next. Go ahead and introduce yourself to the committee.
Good morning, Mr. Chairman. I'm Pat Joyce. I'm the Deputy Director at the Wyoming Mining Association. In the essence of being brief and helping you along this morning, I wanted to represent the 25,000 employees that we have in the Mining Association and our Mining Associates of Wyoming, who are our supply and service companies across this state. And as you all know, majority of our mines are in rural areas, hard to get to. We're not in downtown Denver, we're not in downtown Cheyenne. You might think that the most important thing to the mining industry is our production, our transportation. All those things are very important, of course, our customer base. But the number one issue, the number one effort that all of our mines pay attention to and put a lot of money into is our safety and health of our miners. Suicide prevention is something that we have a presentation on every year at our Safety and Health Show. It's a 2-day program that we put on every fall. All of our members are invited. This past year, we had a presentation on 988. And when we got done, I asked our members, I said, do we want to support this? What do we want to do? And I said, let's, everybody in the room that wants to support this, stand up, and the entire room stood up. It's highly, highly important. We're thought of probably as a very rugged industry right next to ranching and ag. I've been raised in both, and I know the lingo, and I know the stigma that we've talked about here today. I've lost two friends, a college friend and a rancher friend of mine, both to suicide. There's no good day. There's no good outcome when that happens. We don't ignore this. We are not immune to it in the mining industry. We have had suicides not on duty, but of our employees. And so we're not immune to this. We just want to know that we support this bill and we would like to see it passed. There isn't anybody in this state, I think, that can look anybody else in the state and shrink away from the responsibility of addressing this issue. So thank you. I stand for any questions.
Thank you. Any questions, members? I just a question, 46 million in perpetuity to fund this. I mean, let's face it, a lot of those revenues are produced by your people that you're representing. I mean, what do you think? Is this a good way to fund this? What do you think? Or should we put a buck on everybody's phone bill or just say we're taking it out of the general fund?
When I look at our, the demand for our funds that we raise, and granted we enjoy the ability to do business in this state, and what we're called on to handle, not we're called on, but the funding that we raise for the state, of course, goes to education on a lot of other issues. We'd like to see everybody take a bite, take a stand on this. This can land on anybody's door today.
Yeah.
And so I think the sharing the wealth, if you will. I think that maybe it deserves a little more discussion, but at this point, we just know that I don't think Wyoming needs to stay in the #1 position of suicide. So anything we can do to help, we would do that.
Okay, thank you.
All right.
Okay, Representative Bear has a question.
Thank you very much. I'm sorry, ma'am, I didn't catch your name.
My name is Pat Joyce.
Kat
Nobody
Joyce.
ever hears Pat, they just get Joyce.
Thank you, Ms. Joyce. I appreciate that. And sorry for your loss. I know your experience, and I too would like to see Wyoming not be #1. You mentioned the training that you were doing on the 988 number. Had you done training before when it was a 1-800 number, and was there a similar kind of feeling about it, or was that asked back there?
Go ahead.
Mr. Chairman, Representative Bear, when I say we had a presentation, we had a presentation. We don't do training at that particular show. Our mines do training, and I would have to ask each one of them there. I think they get it from local sources. I've made a commitment, but our association has made a commitment to always have this issue as one of our hot topics, our highly visible topics at our safety show. And we would welcome anybody that would come in and do training, make that available to our mines individually, but especially at this health show. Yeah.
Okay. Okay, next, go ahead and introduce yourself.
Thank you, Mr. Chairman. My name's Jody Levin. I'm here on behalf of Charter and Verizon. I'd just like to say that, this is something that's new to all of us. This was signed into law by President Trump as of July 16th. All of the carriers, your telecom carriers in the state had to have the 3-digit code in their systems, 988. Everyone complied with that. This wasn't something that any of us really had a choice in. The choice to the states, however, was how are you going to fund this? So a number of states are doing just exactly what we've been doing in Wyoming, which is trying to figure out what the costs are and how are you going to fund it. Similar to Wyoming, most states used their ARPA dollars to at least get the program kind of up and running, give yourself some more time, figure out what to do. It is absolutely true that in that federal act, that one of the funding options that was given to the states was to put a fee on phone bills. Some states are doing that. In California, it's a 6-cent charge. In a population the size of California, a 6-cent charge funds their system. I came to the interim committee and said, please don't put a fee on phone bills. It's not going to fund your system. That's what we have in 911, and it doesn't fund the system today. So I asked the committee, and I applaud the committee for taking the direction that it did, is to treat this issue with the significance that it deserves and give it a long-term funding source. Whether this is a trust fund, whether it's a general fund obligation, both of those give the funding that this program deserves. And so I applaud the committee, and I'd like you to consider the trust fund concept, because I think this is what this program needs, is a long-term funding source.
Okay, very good. Thank you for being here. Representative Swanitzer has a question.
Thanks, Mr. Chairman. I might have several. I'm just making sure, 6 cents a month, probably in California. Did we do any background research on what it would be for a Wyoming charge? Would be my first question, Mr. Chairman.
Go ahead.
Mr. Chairman, over the interim, as Ms. Somerville indicated, she brought a proposal forward to the committee, if I remember correctly, Andy, 25 cents? 50 cents. 50 cents. And that was, I can't remember how much money you thought that was going to raise.
Okay, one more, Mr. Chairman. So correct me if I'm wrong, but I would assume if it's a national number 988, it goes to your local PSAP, and then they would either route it to a point in Wyoming, but couldn't they just as easily ensure that it was routed to Montana or Colorado? I mean, we hypothetically could contract with 4 of our neighboring states, and if you called from the Bighorn Basin, it would go to the Montana number. You call from Southeast Wyoming, it could go to the Denver number. That is a possibility, I would think, A, and B, has that been explored? Because I hear, oh, we don't want someone in Delaware or Florida, but we easily, the way our systems work, could route it to someone in Fort Collins, to Billings, to Rapid City, much closer, who would have some understanding of our geography and our lifestyle.
Mr. Chairman and Representative Swanitzer, I don't know the specifics on the routing as to whether, when it comes in, if certain numbers can be designated to go to certain states, or if you can adopt a more regional system. I'd have to look into that and get back to you.
We're coming up against a time limit. I just want to ask you, we can lay this bill over, and we, members, couple things. Does anybody here have a noon committee meeting today? Yeah, see, we'll have some conflicts. We could carry this over till next Tuesday. And there's folks, and just bring it up right away at the beginning and continue where we're at on Tuesday. Are there folks who just traveled here, going to be here only today for this issue? And yeah, and so we can do that. And then I'm just kind of looking at you because we're here. We want to hear from you. I want to make sure we hear from you, and that we could just carry it over. Because it's an important issue. We're gonna, we're going to keep working it. Is that okay? Okay, so you're not going to be here next Tuesday. So why don't you go ahead, and would that be okay? And you'll be able to be here Tuesday? No problem? Okay. And I'm just looking around. I mean, if we had a clean slate at lunch, we just carry it over to lunch. But you have a committee meeting, both of you, on adjournment. How about anybody have committee meetings on adjournment?
Joint rules, but it should be quick, but.
I'm just asking you.
Yeah, you're gonna have joint. But we shouldn't have anything, we have no business this afternoon.
No, I thought did they cancel it even? Or no? Anyway.
Okay,
I
how
think
about-
after adjournment,
You'll be our last public testimony this morning, and we're gonna carry this over on adjournment. We have no conflicts with members of this committee, so we'll keep working it. And I'm looking at members of the audience. Can you give me is that okay? And, all right, I just wanna, okay, so go ahead. Thank you.
Mr. Chairman, members of the committee, my name is Clark Fairbanks. I'm with Youth Emergency Services in Gillette, Wyoming, and also a member of the Wyoming Youth Service Association members, nonprofits across the state, serving youth. And I had 2 perspectives I'd like to share. One, urging your support for this bill. Obviously, as we relate to youth, young adults, many times they don't have the life experience. And then as I think of that, both adults also find themselves in situations often where they never thought they might need help, like that they would find themselves suicidal in these situations. So having an easy access number to call is critically important, because they can't think of who is that person I should call? What's the phone number? And when you're in that situation, it's critically important that you have easy access. Then the second perspective that I'd like to share, early in my career, 35 years ago, I was a crisis line worker. And I just want to share that perspective with you in the sense of being a call taker. You answer that call not knowing the urgency of the situation, and sometimes it's critically urgent to get a first responder on the way. And you maintain that contact as best you can to get them help. Other times, it's somebody who's critically depressed, who's maybe in the past reached out to somebody, and for whatever reason, they didn't find that helpful at that time, or it reoccurred, and you have more time to assess those situations and ask them questions about who have you in your life you can reach out to, who has been helpful in the past. So you're that assessor and referral source for them. And I just add that perspective because it adds to some of the questions that have been asked about local. Will they reach out to somebody that they have reached out before to? Will they go to the local person? And in those situations, you really are the professional that's assessing what they need. It's an individualized response. It's not right for every person. But I also want to say, sometimes people reach out just before they intend to complete suicide. And sometimes that urgency is getting them a first responder response, those crisis teams, to get them there and to save a life. And I think that's the perspective that I add, that I just wanted to share with the committee. And the importance of a crisis line is that we want to inform everyone in our state, even those who think they'll never need it. Here's where you can call. So with that, I would stand for any questions, and again, just urge your support of this bill.
Well, I appreciate your testimony. Did you drive down here for this?
I've been down the beginning of this week.
Yeah.
I came down Tuesday.
Appreciate you.
Thank you.
Traveling down. Questions, members? Okay, just, and not that this is in your wheelhouse, but really we've got three options. I mean, we're gonna raise a tax here, 50 cents, or we're gonna just say, hey, general fund, and please don't cut us down the road. Or save some money and just let it work for us forever. And maybe I've said that in a biased way, but it is saving money. I mean, we're not spending 46 million, we're saving 46 million. Any thoughts on that as a Wyoming citizen?
I would defer to you, but I would reiterate that a consistent, sustainable source of funding is important for continuity.
Yeah.
And beyond that, I think that would be a challenge that I would leave with you. But having a consistent source of funding to maintain and build the capacity of that Wyoming crisis line, I think is important.
Okay, appreciate you being there. Remember, Cindy? Okay, so we're gonna just recess the meeting. We won't gavel out, and we'll be back here on adjournment of the House this afternoon. So hope to see you all there. And if for some reason you can't be there, certainly reach out to us through an email to the committee or those kind of things. Share your thoughts. Okay, thank you all for being here today, committee. Thanks for your good work.